Hi, and welcome back to Hey Doc, What's Up? Today we're going to talk about the effects of autoimmune disease and change in men. We've spent the past two sessions talking about autoimmune disease and hormone changes in women, especially swings of estradiol, whether it's in adolescence, whether it's in perimenopause, or whether it's in menopause with the loss of estradiol. But today we're going to talk about it in men. Now remember, we've had this discussion about hormone levels that are typical with men. And their curve is a totally different type of gradual curve and loss of testosterone over time versus what women go through. That's just the way we're wired. But it doesn't mean men don't get autoimmune disease as well. They do. It's not as dramatic, but what I'm here to tell you is that not all guys fit this nice, gentle curve. Other things can happen that will impact that curve in men. And remember, we always talk about the four legs of a chair as the four hormone groups, and that those four hormone groups are talking to each other. So if there is stress in any of those other three hormone legs of a chair, that can impact the curve of this testosterone. So what do I mean by the other three legs? Well, remember the four legs are the male-female hormone, your thyroid, your adrenal, which is cortisol, and your insulin. So if any of those four hormone groups are off, especially with guys' stress, then you may fall off the curve for your age, and you may be at a lower percentage for your age, and you may have no clue that that's where you are. How do you find out? You get your levels checked. And if it is in normal range, remember that's not good enough. What you need to know is it age appropriate for the percentage of where you should be, especially with your free testosterone. So guys doing two jobs, guys spending a lot more time at their job, extra stress with your job. It may be triggering thyroid issues that you're unaware of. It may be triggering a pre-diabetic state and insulin resistance that you're unaware of. And before you know it, you may have your autoimmune system starting to attack normal parts of your body because your testosterone is inappropriately low. So like women with their sudden and dramatic loss of estradiol with menopause, men can have a drop, not as sudden, but they can have a drop in their testosterone. And if they don't get that drop recognized and corrected, they are at the same risk of their immune system attacking their organ systems, because just like estradiol in women giving blood supply per square inch, testosterone is responsible in guys for blood supply per square inch. So why wouldn't you want to know what your free testosterone level is and see if you're on the curve and see if you're at risk or increased risk for autoimmune disease? In guys, the risk of autoimmune, if your testosterone levels drop low enough, is the same risk as it is in women. And remember, your immune system doesn't care that it was normal yesterday. If it's not normal today, it will attack. Once it attacks, it is sensitized to attack. That's when we start checking antibody levels and start following the inflammation that gets caused by that attack on that organ system. So stay tuned for next time on Hey Doc, What's Up?